So I would like us, did we talk about drug absorption?
Not really.
Okay. So I would like us to start there, where we are saying absorption of the drugs. I think talking now, the comrades who want to join after this, rafiki wakae na wao. So keep oscillating mbele na nyuma. So saying absorption of is the transfer of a drug from the circulation to the bloodstream. Whichever route, if you give it intravenous, dermal, intrathecal, topical, or whichever, how much time does it take to reach the bloodstream? And that's why we said if we are giving it an intravenous, then the entire drug reaches the bloodstream. Now, what are the factors that influence the rate and extent of absorption? Chris, kindly read.
The rate and extent of absorption depends on. Oh, my slides has gone.
Your slide have
Okay.
gone.
Okay, it has.
Oh.
Okay, the rate and extent of absorption depends on the environment where the drug is absorbed, the chemical characteristics of drug, and the route of administration, which influence the bioavailability.
Bio?
Routes of bioavailability.
Ni zinaonekana ndogo wako. Kwa simu. Oh,
Okay, the routes of administration other than intravenous may result in partial absorption and the lower bioavailability.
Bioavailability. Those factors are now there. When we speak about the environment, we are talking about, for example, the pH, the effects of pH. What is the influence of pH on drug absorption? It is not a one-way thing. When you talk about pH, it's not a linear phenomenon. Why? The point about pH is that drugs that don't ionize completely are the ones that are more rapidly absorbed. And that's why drugs are formulated as weak acids or weak bases, because weak acids or weak bases don't ionize completely. I hope we get that. So it's not a matter of at the pH as it increases or as it reduces, the drug absorption increases or reduces. No. It's a one cardinal rule that when drugs don't ionize completely, they are more easily absorbed than those that ionize completely. Those that ionize completely become lipophilic. Hydrophilic, but those that ionize completely are lipophilic. So they are easily able to cross the membranes. The next point is the blood flow to the site. What do you think would say about blood flow to the absorption site? If the blood flow is high and if the blood flow is low, in which case shall absorption be higher or faster?
Okay, I think when there is increased blood flow to the absorption side, there will be more drugs will be absorbed because a lot of blood will be passing through.
Thank you.
Unlike that, when there is limited or little blood flow.
Good. So in which areas you would want us never to administer drugs through unless we have no other choice at all. And by that I mean which areas in our body have very limited blood supply. Areas that have a lot of adipose tissue, areas that have a lot of cartilage, yeah, they usually tend to have very limited blood supply. Okay, number three, total surface area available for absorption. What would you say about total surface area available for absorption? Someone else? Miriam, Damwe? Okay, anyone who would like to speak, kindly speak.
Okay, I think the more the surface area, the higher the rate of absorption.
Very great. The higher the surface area available for absorption, the faster the rate of absorption. Good. How about contact time at the absorption surface? If we have a drug having a lot more contact and one that is passing through the absorption surface quite fast, in which case is absorption more optimal? So we have seen how now, and this is very critical for you as, for example, as a nurse, because you administer drugs. What does this mean in terms of when you administer drugs? Chris, your hand is up.
I have a question.
Yeah.
So my question is about this bioavailability.
Yes.
So you have just said, for example, for a patient having maybe say a painful, maybe he's experiencing pain,
Mm.
and we want to actually administer those drugs such as paracetamol,
Yes.
so that to actually slow down or cure that pain that he is feeling.
Yes.
So I think in such a scenario, this patient has altered physiological processes in his body,
Yes.
and that drug will be not actually absorbed 100%. It will not be absorbed, but let me say like 70% will be absorbed. So I think, according to me, from to my own thinking, if we add or if we add to that, let me say we have administered 2 pellets
Yes.
of paracetamol, and we have not reached that 100% which we require. Are we supposed to add another one so that to reach that 100%?
Okay, I get you. However, the drug formulation, the process of formulating drugs, you see, before drug trials are done, I mean, before a drug comes to the market, trials are done. All these parameters we are talking about, bioavailability, efficacy, they will all have been plotted, toxicity, and so forth, they will all have been plotted. So by the time the drug comes up in a particular dosage form, it already will have considered those factors, and the dose they will have formulated for us to administer will actually have considered those factors. And that is why then you're not supposed to, for example, reduce the dose as advised, because then you will have reduced the effective dose. Otherwise, you will find that maybe a drug formulation would be saying, for example, give a gram or so. Probably the bioavailability was something 0.7 or 0.6, but they have put it up. Instead of giving a gram, milligrams, they have said give a gram. So the formulation process takes this care of this and gives us drugs that are already packaged, trying to ensure 100% effective dose. So it's not for us to adjust at that stage because we are not able to measure those changes at that stage. Okay, fine. So back to the slides there. Drug formulations, capsules, so forth. What does that mean? When we have a drug formulation, the way it is taken, the route it passes through will determine the bioavailability. If a drug must be chewed, I think I remember saying some amount of it will even remain within the teeth, in the mouth, along the esophagus, and so forth. So it will not be 100% bioavailable. The next item was which one? Route of administration. The only route that is 100% will give us 100% bioavailability is the intravenous route. The other one is GI, gastrointestinal factors, pH levels. What did we speak about pH? We said pH, drugs that are weak acids and weak bases are more easily absorbed, and therefore they will give us a high bioavailability. But strong bases or strong acids will not. The next is fast pass metabolism. What did we say fast pass metabolism is? Hello? What did we say is fast pass metabolism? Belvin?
Fast pass metabolism is just the initial breakdown of drug in the liver before it reaches the systemic circulation, that is after oral administration.
The metabolism that happens to it. Is it only in the liver, or it can also, that degradation can happen somewhere else also before it reaches systemic circulation? I think some literature suggests that even some degradation can even happen in the GIT. So GIT, liver, before systemic circulation. Okay. So if a drug is a subject of high fast pass metabolism, especially those that are taken through the oral route, then bioavailability tends to reduce. How about patient-specific factors? Age, health condition, enzyme levels, genetic makeup, and so forth. How does age and bioavailability relate? Hello? How does age and bioavailability relate? Between the young and the old, or the adults?
Let me give you the answer.
Yes, Stephen?
Okay, so age affect by drug bioavailability. Let's say in young people, actually, and the difference between young people and the adults. Am I clear?
Very well, we are hearing you, Stephen.
Okay, thanks. So in young people, let's say neonates and infants, we can have delayed onset, sometimes increased absorption due to longer contact, and we can also have things like decreased absorption of weak acid and increased absorption of weak bases. Then when it comes to elder people, because of gastric pH increases, We can have a decreased dissolution of some drugs, and it can reduce metabolism and increase bioavailability of some drugs.
In the young children, between the young and the older people, in which case is first pass metabolism more rampant or more prevalent?
The young.
The young, okay. So if there's a high probability of fast pass metabolism or the high effects of fast pass metabolism in the young, that means the bioavailability of the drugs in the young is generally less compared to bioavailability in the aging persons. Because in the aging persons, bioavailability, fast pass metabolism is reduced. And why do you think it's reduced? We are told partly is because of the reduction in liver mass and blood flow to the liver. So the fast pass metabolism that happens in the liver generally tends to reduce. Okay, and that means small quantities of drugs can have more serious effects on aging persons than it is among the young persons. So that's why when you practice geriatrics, the aspect of dose calculation becomes important. Okay, let's move on. Health condition. Health condition, we cannot pass one general judgment. It depends on which health condition. When you talk about things like renal disorders, if the kidneys are not functioning well, what happens to the drugs that are available for effect?
I think
Okay, Newton speaking.
I think detoxification will be impaired.
Detoxification happens where? Detoxification happens where?
The liver.
In the liver, okay? So in this case, we are talking about the kidney being affected. The kidneys, what's the prime function of the kidney?
Excretion.
Excretion. So it's removing the drug from the systemic circulation in a way. Now, if that removal is not happening, then what happens about the drug that is available to have effects?
I think the excess drug that is supposed to be excreted will be less excreted. So yeah, hivyo haita excretiwa.
So if it's not excreted, then so much the effects of the drug tend to be prolonged and more pronounced than if the kidneys are working well. And that's why sometimes in renal disorders, we tend to reduce some doses of some drugs. Okay, great. How about what is the other factor there? Enzyme levels, again, we can't pass one specific judgment. How about genetics? Again, we can't pass one sentence per se, but we know there are some people with some genetical makeups that make them easy. I know comrades here, yesterday was Madaraka Day, or the other day, and this long weekend, I'm sure people went out. There are guys who will take 1 beer and they black out, and there are guys who will take 10 and they are just stable. Why? Mika?
Yes.
Any idea why some people can take 10 beers and they walk home, and somebody else takes and blacks out?
I have no idea unless I go and ask those who are used to.
Okay, Dennis, help us.
I think it is because the amount and type of food taken. When you take beer, if you have eaten skuma and some small ugali, utazima haraka. Unlike if you have eaten meat and strong food, you'll
Yes.
even drink 10 beers and strong.
Okay, giving advice, guys, as you go out, eat what? Eat strong food. Has a hand. We would like.
Okay, about alcohol, I just think it's all about the liver because we've said that detoxification and alcohol, somehow I feel alcohol is either a drug or a toxin. So kuna watu tu wamezaliwa na enzymes type tofauti, ile strong, then kuna wale wako na weak. So saa zingine ni genetics tu, si story na food.
That's true. In fact, okay, to a small extent, it's food, because when you eat highly proteinous foods, so the absorption of alcohol in the stomach. Then it has been absorbed, the metabolism. There are people with enzymes that will help metabolize, so it doesn't even the system. Those guys effect will in a prolonged. So what huyo amekunywa 10 na amka tu vizuri, huyo alikunywa 2 na ni mgonjwa, because of differences in the metabolism of the drug, which has the background genetic predisposition. Okay, so you see, these things are good. From 1 or 2 slides, there's quite a lot of debate, and that is why, as you read, the temptation to cram these concepts, because they look straightforward. The application is what counts, that in every one sentence, it is in terms of how you rush into trying to cram. You can read these slides in 30 minutes, but then when you start to speak is when you realize you've conceptualized what you are reading or you have not. Okay.